So this is a demonstration video of Stimuplex HNS12. So HNS12 basically comes in this kind of box case. Once you open it, what is there in it? You have a user manual and the kit that comes along with the product. You have the main machine, and then you have this electrode cable. So, and if you have ordered a Stimuplex mapper pen, then that is also something that you will be getting separately, from which you have to remove, and you can basically place the mapper in this particular place. So what all you require for a good demonstration of Stimuplex HNS12 is the machine. This machine basically works on 9-volt battery. How do you place the battery? You just align the electrodes of the battery like this, and then you place it on top of the green ribbon like this. How you remove it? Just by pulling this ribbon. The second thing that you get with this is an electrode cable. So now how do you fix the electrode cable? You fix it at this port where you have a sign saying that instrument is there. So you just have to place it like this, attach it here. Your electrode will have two ends. The one end is an ECG clip which will go and attach to the skin electrode, and the other pin which will get attached to the mapper pin, and again when you are attaching the needle, it will get attached to the needle. So like this. When we talk about the machine has the switch on switch off button here. You just give a long press and the machine will start. You have a 3 shortcut keys basically to adjust the 3 main functions of the current. One is setting up the threshold current here in MA. So you can either set it at 5 milliampere or 1 milliampere. You can set the time duration of the current through this button, which is represented as milliseconds, ms. You can keep the current varying between 0.10 to 0.30 and 1 millisecond. So generally in a normal adult, the work can be done and you will get the motor responses if you are just keeping it at 0.30 milliseconds. 1 millisecond is basically required where you are working with the patient who is suffering from a diabetic neuropathy, because the threshold for them to receive the motor responses or to feel any response is on a higher side. Then coming to the third very important function, that is the hertz, that is how you keep the frequency. So HNS12 works on 3 types of frequencies. You can see here 2, you can change it to 1 hertz, and you can change it to sense. Now what is sense? Sense is nothing but sequential electrical nerve stimulation technology. So what we are doing here is when you are passing a current will never flow in a continuous manner. It will always flow in terms of burst of the waves. So when you are saying that the machine is working at 1 hertz, that means that in a particular time frame it is the one burst or a one wave of current that is passing. When we are talking about 2 hertz, that is 2 frequency, like 2 waves per second or in that particular time frame. In sense, we are actually talking about 3 hertz. So here in this, there are 3 waves which are passing, and first 2 waves are of similar duration. The third wave is of a longer duration. What it does is that it reduces the risk of losing a twitch or losing a motor response based on the marginal change or movement of your hand. So it maintains the twitch for a longer time. You will be, even if you are in the vicinity of the nerve, you will be able to see the motor responses. That is an advantage and a USP which is there only with HNS12. Now apart from this shortcut keys, so all these keys are very functional, and most of the functions you can adjust using only these 3 keys. We have also given a long cut keys here. So you can see here, this comes the main menu. You can navigate the menu by using up and down keys. You can use this button to do a back and this for OK. Now coming to the readings. So we have given a very good large display screen which gives many of the information that is required during the nerve stimulation. Now you can see here, once I have increased the current increase and decrease you can do using this digital knob. You can see there are two currents which are showing. The upper one is what the machine is emitting out, and the second one here is what the patient is receiving. Now there might be, if there is some impedance that the patient is giving to a current that has been exposed to the patient, there will be a change. So if there might be a case where the machine is giving out 0.5 milliampere but the patient is only receiving 0.5 or 0.55 based on the impedance that will show here in kilo ohms. Now moving to the demonstration part. So for the demonstration, what you basically require is a skin electrode. Now skin electrode can be placed anywhere in 10 to 15 centimeter from the point where you are going to stimulate the nerve. So you will place the skin electrode here. The ECG clip that we were talking about, will basically get attached there. You would need a little bit of coupling agent. You can use a water or an ultrasound gel for this, and then you can start with the mapping of the nerve. So we start with 0.5 milliampere. So see here, once your circuit is completed and your mapper is basically touching the skin, that's where your circuit is completed and it will show you a green color signal. And then slowly you have to start looking for the stimulation of the nerve. Now one thing to note here is that when you are doing with a mapper, what you can do is you can increase the intensity of the current because you are going percutaneous. So what you can do in this situation, you can keep the frequency as 1 or 2 hertz. You can give 2 hertz also, and in terms of the time duration you can change it to 0.3 and threshold current at 5 milliampere. So basically, if you can see at this part of the hand, you've already started seeing a motor response. So this response with help of mapper we have received at 2.5 milliampere. You can see a very good motor response. At this point, once you have identified the nerve or you located the nerve, you will just mark the landmark, and then you will go ahead with a needle for a further stimulation. Now when you are going ahead with a needle, what you do is you decrease the current again back to the zero, and then once you have inserted with the needle, gradually you will increase very slowly at 0.5 milliseconds, 0.5 milliampere current. So you will start with 0.5, you will go to 1, 1.5, and then say at 1.5 with help of the needle you have found the motor responses. At that point you slowly again decrease the current. So you have to give the or inject the drug only when you are able to see the motor responses at 0.3 to 0.5 milliamperes. Thank you.